We used to think that pain was a direct transmission from the tissues. So if you sprained your ankle, we would have information from the tissues in the ankle, and that information would be relayed to the brain, letting you know that you damaged some of the ligaments in the ankle. The more damage you had, the more pain you had. However, this doesn't always seem to be the case, so in this episode, let's talk about central sensitization. I think one of the best ways to describe central sensitization is to give you an example. So let's say you own a house, and while you're in the house, someone breaks in, you have an alarm system, the alarm starts going off, and they steal a bunch of stuff downstairs. They leave, they took all your stuff. Now you cleaned it up, you replaced all the stuff, you fixed the window or the door, whatever it is, and a couple days later, you're in bed and all of a sudden you hear some rustling in the bushes outside. Your brain will automatically kick in and say, the burglar is back, they're trying to rob the house again. So you get up and go check everything out, you see nothing. Turns out it's just actually the neighbor's cat rustling in the bushes, but you instantly thought it was a burglar. And this kind of explains sensitization. Normally, if you heard either the bushes rattling or a car door outside, you wouldn't instantly get up to go check who it was. You would say, oh, that's the neighbor coming home from work, or that's the cat or the dog or something like that outside. But because you had the experience of someone breaking in, your body's in kind of high alert mode. And pain can act in a very similar mechanism. So initially, if we have an injury, say we roll our ankle, we'll have pain letting us know that there was damage to a ligament or a muscle or something like that. But after 6 to 8 weeks after the tissues have healed, if pain persists, it's acting much more as a protector of the body than it is an indicator of damage to the body. And if we go back to that house analogy, well, when there was a burglar in the house, somebody was in there actually stealing, so the house alarm was going off. But over time, when there's no burglar around, anytime you hear something in the backyard or you're just laying in bed and you instantly kind of think, oh no, did I lock the window? Did I shut the garage door? Those are just protective mechanisms. Even though the burglar isn't around, your house isn't getting robbed again. And so when we're treating persistent pain, central sensitization plays a big role in that prolonged pain state. And what that means is that we should probably focus less on trying to catch the burglar, assuming that the burglar is not trying to actively break into the house, and instead trying to promote safety within the body. And we can achieve this by gradually exposing the body and our tissues to those activities and movements. And that will allow the body to recognize that it is safe to perform those movements, and there's no reason to protect the body as we did before.